The Kosher Kitchen family proudly supports Breast Cancer Awareness Month. Each year is a time to honor survivors, raise awareness, and champion those impacted by breast cancer. We've partnered with a few charities and organizations and encourage you to do the same. You can do your part by simply joining in your local walks, runs, or volunteering. As a token of our appreciation for your support, we're offering 15% off our seasoning bundles. So visit shoprmm.com and as always, keep it kosher. Hello, everyone. Thank you for joining me. You know, I never come on a Wednesday, but I'm loving doing something new because it's Breast Cancer Awareness Month. And in this month, the most amazing thing is I get to interview some friends and some people that I didn't even know their story. And today I want to introduce you to my dear friend. I was saying to her behind the scenes, Lynn, I know you, but I don't know this story about you. She is a lady that has created a skincare and makeup line, and my skin has changed, as she can tell you. My makeup color is more pronounced and more bold because of her influence on me. From I met her, I said, "You're my new friend," and we've clicked ever since. But tell them a little bit about you, Lynn.
Yeah, so Dr. Marina, thank you so much. You are very dear to me, so I really appreciate you giving me this time. So I own Sedoni Skincare and Beauty. My girls and I started the brand in December of 2019, and it has just been nonstop. There's been ups and downs and sideways, but it's been nonstop. I've lived in Texas for about 17 years, and I'm a transplant plant from South Florida.
Nice. From hot to hotter.
Exactly. Exactly.
And the lovely thing is about you, Lynn, is that in getting to know you and watching the brand grow and let the story behind the brand, but being that it's Breast Cancer Awareness Month, I discovered this whole new side of you, the story that I didn't know. So when were you first diagnosed with breast cancer?
Dr. Marina, I was diagnosed in 2007. So
Wow.
in February of 2007. Um, but if I can back up a little bit, I mean, I had just moved to Texas when I was diagnosed. And little did I know, I had actually had breast cancer for at least a couple years before I found out.
Wow.
I knew that I had a lump in my right breast for a very long time, and
Mhm.
it didn't even dawn on me for a second what it might be.
Yeah.
I knew it was there. I went to my doctor and I shared it with my doctor. He said, "Well, let's just send you for a mammogram." So he wrote out this prescription and said, go to this diagnostic center and get your mammogram. Well, of course, I was too busy and I didn't go.
Yes. Wow.
Yes, I did not go. It was took too much of my time. I was working
Yeah.
like crazy. I had two young girls and I didn't go. So when I was getting ready to move to Texas, I said, let me get all my doctor's appointments out of the way. Let me
Mhm.
get my girls' doctor's appointments out of the way because we
Yeah.
wouldn't have a doctor getting started here in
Right.
Texas.
Hmm.
So I went to the doctor. I went and got that old timely mammogram that he had sent me to
Yes.
get,
Yes.
and we
Old
packed
school
up
way.
yes, we packed up and moved to Texas. And I was here for maybe a month.
Hmm.
And I got a phone call saying that we found something that was questionable in your mammogram, and we'd like to send you the films. Back then, you had to send the films,
Yeah.
um, and we'd like to for you to go and get this checked out. So I received the films. I went to the Sue DeMille Center over here in Plano. I got
Hmm.
the mammogram there, and they said, yes, there's definitely a mass there. We need to check it
Hmm.
out. So they did a biopsy. And once they did the biopsy, determined that it was positive for breast cancer.
Yeah. And what stage? Did they tell you
It
what stage?
was it was only stage 2, but I had spread to my lymph nodes under my right arm.
Right. Right.
Yes. And then once I had a second mammogram, they discovered a second tumor in the same breast.
Wow.
Yeah. So actually, the two tumors were growing in different directions. One
Mhm.
was growing outward and the other was growing inward. So
Wow.
my doctor called the tumor that was growing outward the one that actually saved my life, because I wouldn't have known anything had
Okay.
I not, felt it in the past. So,
And so
uh,
you just slid past it. So that was the one that you felt first. That was the lump that
yes,
you felt first, right?
yes, that was the one I felt first. And while it was small and a very, about the size of a pencil eraser, that
Mhm.
was the one that had spread to my lymph nodes.
Wow.
So I opted to try to do a lumpectomy. So
Mhm.
I went in for surgery. The lumpectomy came back that all the margins around the tissue that was removed was dirty, so to speak.
Mhm.
So,
Yeah.
so they said, well, I had very large, dense breasts, and they said we can
Yeah.
go back in and try to remove more,
Yeah.
without disturbing the integrity of the breast. But I just said no. I said no. I was 42 years old.
Yes, I was just going to ask you.
Yeah, and I said, I don't want to do this again in 5 years if it comes back in the second breast, or,
Mhm.
so I opted to have a complete mastectomy.
Yeah, well done. And what is that like receiving? Because you're in your early 40s, right? And this is where they tell us to start scheduling mammograms, right? And so
Correct.
and this was prior to that 40-year mark, because you just glossed over it, as we women do. We're not the
Right.
priority. So when you hear that, what is it, what goes through your mind? Because you're getting ready to transition, to leave one transplant, I should say, leave one place to
Right.
another. You're coming here, probably need a community. You don't have that yet. I've asked a lot of questions. Let me stop. Let you answer.
Well, when I first got the diagnosis, I really don't think I really grasped the gravity of what was happening.
Hmm.
I think, when the diagnosis came down and the doctor said, you have breast cancer, and I think I kind of said to myself, okay, so what do I do about it?
Mm.
It didn't hit me that I was about to embark on a journey of 10,000 emotions, including,
Yes.
fear and
Mhm.
frustration and
Mm.
just all of those things. And so it wasn't until I went for my first counseling session with the
Well,
physician, with the at the cancer center,
mhm.
with all the nurses. They give you all the information. Here's a book to take home. Here's all the good stuff to read. Here's what's going to happen to you. Here's what you can expect. Once
Mhm.
I saw that, and I took that book home like a book from school, and I
Yeah.
began to flip through it again, still not even thinking
Uh-huh.
that
Uh-huh. It
what I
hasn't
was about
registered
to
yet.
happen. Yes, I read it and I just became extremely angry. And I
Mhm.
said, you mean to tell me that you're going to take my healthy body and you're going to do this to it and make me sick?
Yeah.
So I
Yeah.
said, there's no way I'm doing this. I became the most angry patient
Mhm.
ever.
Yeah.
I said, there's no way I'm doing chemotherapy.
Mm.
There's no way I'm doing all these surgeries. I've never had so much as a broken finger.
Right.
So, um, so after that, I went and got three more opinions because I was just not convinced.
Well
I said,
done. Well
I,
done.
yes, I need three more. I need other doctors to tell me that
Yes.
it's necessary
Mhm.
before I do this.
Mhm.
So, yeah, the answer was yes. It was
Uh-huh.
yes. Everybody was yes. Get the chemotherapy, because while the tumor was small, it had metastasized, and I
Mhm.
had spread to the lymph nodes under my arm, and so
Yeah.
lymph nodes had to be removed and
Mhm.
everything. So I had 6 rounds of chemo. I
Wow.
of about 6 different surgeries.
Mhm.
I had breast reconstruction
Yeah.
afterwards. So
Yeah.
yeah, it was horrible. But you don't know it um, until you actually begin the process.
Everyone that I've interviewed over the past few years, I've started to do this, Lynn, have dedicate this month and interview different people, and everybody says, it's that initial reaction, fight, flight, and I add a third one, freeze. You were determined to fight, but not fight as in, yeah, I'm going to be busy. I'm fighting because I don't want to do this. You were fighting, but
Exactly.
but not for, okay, I'm going to get through this. You are fighting that I don't want this to happen to my body. So what is the switch that happens that you say, okay, I want to live?
Once I realized that this was for real. This is now a part of my life.
Mhm.
So I sort of came to this acceptance phase
Mhm.
where I said, okay, at the time I was very healthy. I was working out every day. I had a
Mhm.
personal trainer. I was probably in the best shape of my life. So I couldn't imagine
Right.
now being sick
Mhm.
from medication or chemotherapy. So I think in the moment when I went back for my first chemotherapy session, because during the counseling sessions, you're actually in there with other women who are starting the treatment at the same time.
Wow. So it's like a group.
That's exactly right, like a group. And so there were six of us in
Mhm.
that group. Um, I was new to Texas, so I didn't have any family here. I
Mhm.
had nobody with me, so the other patients' families became my family.
Wonderful.
And
Wonderful.
so it was then, I think, when I looked around the room and I saw everybody, all the women there had their husbands, their mothers,
Mhm.
both parents, very
Mhm.
close friends and sisters, and I
Yeah.
was sitting there with no one. I thought to myself, oh my gosh, this
Mhm.
is serious.
This journey, and it's going to be a lonely journey, which
Yes,
you thought.
yes, yes, it's going to be a lonely journey. But I really don't think that in that moment, even though
Mm.
I felt like I was more aware of the seriousness of it, I
Yeah.
still didn't have a clue what
Mm.
was down the pipe. I
Yeah.
had no idea.
Yeah. And so this support group obviously became your family. So how did they support you?
Well, it was really cool because despite being on chemotherapy, so
Mm.
every third Thursday, I would show up for my chemotherapy, and the other women were on the same schedule. So we
Mm.
would walk into this massive room with all the little beds and the infusion centers, and
Yeah.
we would have our laptops and phones, and we'd be working, trying to work through, getting our infusion. So we
Yeah.
hooked up. I had my port here, and
Mm.
everybody had a port, so we just get hooked up to the
Yeah.
chemo and do our work and peek and say hello to each other. And some of the other family members would kind of come by and ask me how I was doing. And I was always in there by myself. They would say, "Are you okay?"
Yeah.
Um, they brought cake and all these things that we all shared. We became like this sisterhood.
Yeah.
Um, but yeah, I mean, it was amazing. Just that it was different for me.
What would you say was your lowest point? Because all of you at some point hit a low point where you're absolutely challenged. What was your low point?
Oh wow! Now I'm gonna get all emotional when you talk
Mhm.
about the low point.
Yeah.
So they give you a lot of medication.
Mm.
And for me, when I went to my first chemo session, I was sitting in the chemo chair getting my infusion. All of a sudden, I started itching everywhere.
Mm.
And the nurse was sitting so close to me. She was sitting like, right opposite me. And I kept thinking, why is she sitting so close to me? Like, back
Mm.
up. Are we going to kiss or something? Like, what's happening here?
Mm.
So she was actually watching my reaction
Mm.
to the infusion.
Yes.
So I started to break out in little hives, and she said, "Okay, you're allergic to something." So after determining what I was allergic to, then they gave me all these medications to take prior to each chemo session.
Wow.
So about the third round of chemo, I had a chart,
Mm.
and around the third round of chemo, I had to start taking X drug on Tuesday,
Mm.
take two of these on Wednesday, and work my way up to Thursday.
Mhm.
I was so angry and so defiant. I said, I am not doing this. I'm not taking this medicine. I'm
Mm.
gonna go get my chemo and
Mm.
I'm gonna be just fine. So I pushed it aside into the nightstand and closed the drawer. I didn't
Mm.
take any of the medicine. It consisted of steroids and drugs to help you tolerate the chemo.
Yes. Yes.
I
Yes.
go there, I get my chemo, and I didn't tell the nurse that I had not taken the prep meds,
Mm.
and I was fine until I left there. So I get in my car, I'm driving home, and I passed out as soon as I walked into my apartment.
Mm.
And I woke up hours later,
Wow.
hours later, and was disoriented. I felt very, very sick. I had to stay in bed for a couple days after that. So, needless to say, I went in that drawer and I got those medicines. You're laughing, but it was totally not funny in that moment.
We can laugh now.
Right.
You're over it now. But that is the thing. Because everyone I talk to have a different mindset and a different approach. And in your defiance, you had to at some point submit to
Right.
come into the fullness of that recovery. And so, if you could say anything to encourage somebody right now who's going through it, and in your case, you didn't have family members, but you saw family members there, what would your encouragement be to them, Lynn?
I would say to get as much information as you can. The more information you have, the more questions you ask about your own health, about your own treatment plan, the better you'll feel about it.
Mm,
I think they gave me so much information that I just got angry about it and said, this
yeah.
is absolutely crazy.
Mm,
There's no way. But in the end, it turned out to be the best tool I had to just
yeah.
really dig in and seek treatment that I needed and just to survive. Because, they started to give me prognosis. So I
Mm,
had a type of breast cancer that's called HER2 positive breast cancer.
wow.
And HER2 positive breast cancer is an overexpression of the HER2 protein in your body, and it's associated with a poor prognosis and a high probability of return.
Mm,
So I had less than a 50% chance of survival past 5 years on a
wow.
baby tumor that was metastatic.
Mm,
So I would say all the information you can, read everything,
yeah.
ask the doctors for all of your medical records, and then arm yourself with the strength you need with all your information, all the records, and just dig in because it becomes about a choice. Are you
Mm,
gonna let this thing get you? Are you gonna let it win, or
mm,
are you gonna beat the breast cancer?
right.
And you have to accept that if you need a mammogram, I'm sorry, if you need a mastectomy, then you need to really think about that.
Mm,
Really think long and hard. For me, I was single. I wasn't married at the time. That was a big deal for me.
yeah.
How do I explain this? That I
Mm,
had a mastectomy. So
mm,
um, it's very emotional, to say the
yes.
least. So I
Yes.
think the more information you have, and then ask too. This is what I missed during my treatment. I missed asking what happens afterwards,
Yes.
after the mastectomy.
Uh-huh.
How's
Uh-huh.
my mind? How's my body? How do I live through this? Those are the
Yeah.
things I didn't ask, and I think those are really important.
Yeah. Because a lot of women feel, especially when they've had a mastectomy, that they
Right.
feel less of a woman, and that's now passed because of all the medical technology and advancement and the wonderful counseling sessions that happens now. If you're open to receive it, let's just be honest. If you're open to receive it, yeah,
Absolutely. I wasn't.
yeah.
I wasn't.
And and so I'm just so thankful, Lynn, as I've got to know you over these past, I think it's 4 years now that I've
I
got
think
to know you.
so.
And I didn't know this story about you, this side of you. But watching, what I can say about you is that, and it's a phrase I have, and it's a really lovely Pentecostal phrase, but it's so true. You don't look like what you've been through.
Oh, yes.
and
Mhm.
and then you help to beautify women, right? And
Right.
so this is not only you're here, but you're paying it forward. Would you say that that's a good analysis?
Oh my goodness, absolutely yes. Because I tell all the women who sit in my chair, they must think I'm crazy. I said, have you had your mammogram? Because I don't want to see that happen. I had no idea during my journey how many women
Do not.
have had breast cancer, who've survived or and even passed away from breast. I had no idea.
Yeah, yeah,
And some of us think that because, oh, it's not in my family, or we just don't think about it. And I
yeah.
know, like I said before, I did not even give it a thought. I felt
Mm,
the lump in my breast, never once for a second thought that it
mm,
was breast cancer.
yeah.
Never once.
Yeah, and especially we're finding out that I forgot the statistics because I've really looked this up that a lot of young women under 40 we they stress getting your mammogram begin getting mammograms at 40, so you have a baseline, but it's
Mhm.
amazing the statistics of young women even without childbearing, without giving birth, are being diagnosed with cancer, and again ignoring the signs because yeah, it's not in my age group, it's not in my family, it's not in my medical history, but we do. And so I'm just glad that I have this opportunity to highlight this on my platform, to talk with you. We've never talked about this.
I don't know why.
No, we talk about everything else. But this is what we need, ladies. We need to be friends and sisters to the women around us. Because one of the things I do when I go for my mammogram, I make sure that I announce it. And now that they have the 3D mammograms, oh my gosh, it's such a
Yes,
game changer, because you don't like see a shadow and you don't have to wait 3 or 4 months. They do immediately. You come back in and they do the ultrasound. So technology has really advanced to help us. And Lynn, I told you that I did my annual 5K, and I spoke to Sylvia just recently, and I said to her, how many people participated? She said about 700 people participated, about 1,000 people
what?
went there, and I came third in my age group. I'm so proud of that.
What?
Yeah.
Congratulations. That's fantastic. Oh my goodness. I had no idea.
Thinking it's like 300 people. I get thinking, oh, yes, about 300 people there. And when you reposted it, I was like, and I came third. And so I'm just glad that we have this opportunity to encourage our women, encourage the stranger
Mhm.
who will hear this, encourage the person who will share this on and pass it on. Even you men, pass this on to your women, because
Yes.
we really do need to take care of ourselves. And Black and brown women, even though we're not the highest rate of breast cancer, we're the highest rate of mortality, death, because
Correct.
we don't take
Mhm.
care of ourselves. We don't go for the mammogram. We don't make time. And one thing I know that Lynn is very big on is self-care. Come on, Lynn.
Absolutely.
Let you have the final word. Tell them what to do for self-care. Come on, Lynn.
Well, I think I always been sort of a self-care kind of a guru kind of thing. I love products, always loved products. I mean, everything I'm interested in. But now, even more so, since after the breast cancer battle, I mean, it's so important because when you feel good, then you feel like you look good, and and you can easily share that with other women. Talk about the importance of really taking care of yourself first. And I think so many of us young mothers, we're so focused on our families and our
Yes.
children and the home, and we have to take a few minutes, just a few minutes, to
Mhm.
just take a nice warm bath, um,
Yes.
slather on your favorite cocoa butter or whatever you want to put on that makes
And
you feel good, and do it for yourself.
please highlight your natural skincare products.
I-
Please do. I'm giving you permission. Please do a shameless plug.
Okay, so you have to try the vitamin C. You have to try
Mhm.
the vitamin C cleanser, vitamin C serum. There's a vitamin C lotion, and there's a brand new toner, Dr. Marina. There's a vitamin C toner. I know you have to have it. Yes, the vitamin C line is our number one seller. It runs off the shelves. Everybody loves it. It's very popular. So thank
Yes.
you.
I buy it in bulk because
You do.
I do, I do. I buy it in bulk, but now I'm going to vitamin C toner. Thank you so much, Lynn. I will be doing another interview next week. And I'm just so thankful for my friends and the strangers that I met through this now, that are now my friends, because we get to highlight with our story, with our honesty. Somebody said, thank you, Lynn, for your transparency, because this will help so many. You don't know how to start the discussion. I've given you ample conversations to begin this. And the gentleman, the first one, it was the uncomfortable conversation, but it was so needed. And I think I'll have a gentleman next week. So I'm so grateful that I made a declaration and God has made it happen. So thank you, Lynn. Again, I wear her products. I use her products. She's part of my Celebrate You. So this is the face behind those of you that have received the Sedona skincare. This is the face and the brand behind it. She looks amazing. She is her brand, really is her brand.
Oh,
Thank you all for joining me. So please click and share. And once again, Kosher Kitchen is the
mhm.
sponsor for this month, for the Breast Cancer Awareness Month. And you can order your Kosher Kitchen seasoning at 15% off. And I've done a special, I call it PSA, about one of the ingredients in our Kosher Kitchen seasoning. That is a cancer fighting agent. When we tell you
Ooh,
our things are healthy and organic. So I'll send you the video, Lynn, but and I tag you,
Wonderful.
Lynn. Yes, I know. But thank you all. Thank you for joining us. Tomorrow night is our Infinity Center, and tonight Dr. Rennie continues the Yom Kippur teaching, and the I will pray. Bless you all. Thank you, Lynn. I love you. Thank you
I
all.
love you too. Thank you, Dr. Marina.
Oh, absolute pleasure. Bye, my love.
Bye.